of those yoga people, but we cannot have body contact. That is to do with social distancing, and I'll call it my fourth technique. Technique number 5 for pharmacies, and this can also be a very good screening technique. It's called the temperature monitoring technique. I'm sure by now everyone has seen the infrared thermometer. Okay, it has an advantage of measuring temperature without having contact with the patient. Now, when you're using this thermometer, you are supposed to read the instructions of that particular thermometer before you start using it. Why? Because they give a distance in between. You can take the measurement. It has a setting for surface temperature and then body temperature. You are supposed to first set your thermometer to read body temperature. So you point it at the client, it measures temperature, and this is what I recommend. Body temperature normally is around 36.3 etc. But if a person has temperature above 37 that person is not supposed to be allowed to access the pharmacy. Why? Because COVID, like any other viral infections, tends to increase the body temperature, and its temperature normally spikes so high, and the difference between it with the other temperatures that are raised with other diseases is that when it rises very high, it does not fluctuate. It remains high continuously. So if you receive such a patient, you may sit them aside and take their temperature again after 20 minutes. What I do at my place, I've been able to isolate 3 people who had that kind of temperature. I take down their phone numbers, location of where they stay, their LOC, and then phone numbers, and I forward it to the COVID team to follow up. I do not allow these people to access the premise. The first person I had with high temperature, we discovered is a dialysis patient. When they discovered, when they followed up, they were allowed to go back to their home. And then another patient had malaria. They actually had their lab results with them. She had very high temperature, but when we sat them down and then measured again after 20 minutes, the temperature had gone down. We served them from outside, but it wasn't a worry. And then the third patient, we served them from outside and also referred their contacts to the COVID team, to the COVID-19 response team. About this body temperature measuring technique, you have to note the following, that the person measuring the temperature should wear a face mask. They are also supposed to sanitize as many times as possible. The thermometer, the infrared thermometer is also supposed to be sanitized of operation and at the end of operation as a must. And it is also supposed to be frequently sanitized. So I'm going to call that my technique number 5. Then technique number 6 is the hand gloves. Me personally, I discourage that medical staff should use gloves in a pharmacy. Why? Because gloves are rubber. When they get any infection, it takes so long to leave. And then when you have gloves, you get confidence to keep touching here and there and there. And then at times you even forget to keep sanitizing. So I would prefer that medical staff should use their bare hands and keep sanitizing after every client. And then the cleaners should be given gloves. They use the gloves for cleaning the floor, cleaning the doors, cleaning the chairs, etc. And before I leave this hand glove thing, I have to remind us that the floor in a pharmacy should be cleaned at least 4 times a day. So that is my technique number 5. Technique number 6, I want to point us to the water dispenser. Do you realize that whoever goes to the water dispenser touches the same point to draw water? So you are supposed to give attention to the water dispenser. You disinfect that area that they keep touching regularly. And I also advise, instead of leaving the client to draw for themselves water, it's advisable, it's the staff that should draw water and give to the client. And then you dispose away the disposable cup. Okay. Then number 7, this is a face shield. It's a new one for other people, but I think it has it has additional protection compared to the face mask. Why? Because with it also protects the eyes, and then it protects the entire face and also neck. So if you can afford this face mask, would be the best option to use in such a facility as community pharmacy. So that is technique number 6. Number 7, we are having other pharmacies going cashless. This is quite hard for community pharmacies in Uganda. Why? Because we are still stuck with the paper money mentality, but other pharmacies are encouraging their clients to pay by mobile money. Other pharmacies have put up Visa machines, and people are paying using their Visa cards, and it's a good way to sort of reduce paper money that is handled by cashiers. So in so doing, you are protecting the cashier. So I'm going to call that technique number 7. And then technique number 8, I'll call it cleaning and disinfecting. The premise you are using is supposed to be cleaned. And you as a pharmacist, you are supposed to stand and observe the corners or the areas that clients regularly touch. I don't know, but by default, when I observe my place, I see almost every client touches the counter. I see some clients touch the door as they go out. I see some clients, when they get a chance to sit on the chair, they touch on the chair handle. You are supposed to stand and observe which areas are commonly touched by clients. And when you discover the area, if you can't use disinfectant, sanitizer to disinfect that area, you use water and soap, or use a mixture of jig, and make sure you regularly, at least 4 times, clean that particular area that is commonly touched. So for me, I've said that the floor, they step on it, of course it has to be disinfected. The doors, I see most of them, the counter, etc. I give them attention. Also, I want to draw your attention to clinical cots. This is a big, big danger, because you may find in other facilities, people use clinical cots for only identification. They don't use them for protecting themselves from that. You will find someone puts on clinical cots and they don't even button it up. They are just using it for identification. So in this COVID era, I would encourage, if it's possible, let people get more clinical coats, and then every coat that is put in a particular day, it should be washed with soap and water before it's used on another day. We are not going to use clinical coats many times a day. So I'll call that my technique number 8, and I think I will end here so that we go into the interactive session. And these are some of the references I used. I'm saying some because I didn't want to do many slides, and I will end there for now. I welcome your input, and that is it. Kent, over to you.
Thank you very much, Dr. Gonja. So I have a couple of polls here. So the polls will pop up on your screen, and you just respond to it accordingly.
Pardon?
Yes, this is a poll that the participants are going to participate in. We want to know, for example, if they have conducted any training so far in the pharmacy. You talk so much about trainings. So,
should I stop the share?
Yes, you can stop the sharing.
Should I remove my slides? Okay.
Yes, that is fine. So we
okay, now you can talk.
Yeah, fine. We are seeing the polls on to see how many people have so far conducted trainings in the pharmacies. Now let this run for about let's say 40 seconds. Then we'll see.
Are you on, Kent?
Yes. So I'll end the poll. We can see that from the poll, around 45% of the participants have conducted some sort of training
Mm.
pharmacy. Uh, so these are the results.
Wow.
You can see
Mm.
45% so far have done training, 25% haven't done it. So we hope after this, this webinar, they can be able to conduct trainings for their staff. So I'm going to just put the second poll, which will be the last, and so this is about procedures. So we are asking the participants if they have written any procedures for cleaning and disinfection for COVID-19. So do you have SOPs in your pharmacies that say, the counters have to be disinfected every 1 hour? Do you have any of those SOPs in your place? Because after this webinar, we hope, from what you've learned so far, you can be able to put some of those procedures within pharmacies. So I'll let this poll run for about 50 seconds, and then we will see the results. Okay, we can see the results that actually majority of our participants don't have any SOPs in place for cleaning and disinfection, specifically tailored for COVID-19 prevention. So we do hope after this training that you can be able to have documented procedures within your pharmacies for actually doing the cleaning and disinfection. So thank you so much for participating. I'm going to go into the questions. Gonja, we have so many questions. We have so far 10 questions. So the first question is from Buleni Milton. He emailed this question to us. He's asking, is it possible to do research in herbal options for treatment of COVID-19? If there is,
Um,
someone use the CSU laboratory?
okay. Can I answer?
Yes, please, go ahead.
Yes, it's possible to do herbal research on COVID-19 because I've seen a call out from the Pharmaceutical Society of Uganda calling people who would want to get involved into the research of treatment or prevention of COVID-19. And I'm sure there is a team that is already doing research. I have seen somewhere where Dr. Lutoti and Patrick have spearheaded this. So if this is your interest, please contact the Pharmaceutical Society of Uganda and you will be helped.
Thank you, Gonja. I also would like to inform the participants that we have a webinar that is coming up on the 29th of May, going to be presented by Dr. Nyase Rona Lamaza. It's going to specifically be around herbal medicines, the potentials of herbal medicines in treatment of COVID-19. So the second question is from Godwin. He's asking, how has the pandemic exposed the weakness of our medical and pharmaceutical care?
This is a very interesting one. How has the pandemic exposed the weaknesses of our healthcare as a country?
Yes.
There are very many ways. If you are to observe critically, all the attention, I'm not saying 100%, but over 90% of the attention and energy has been shifted to COVID-19. And the other diseases that have been killer diseases before COVID-19 are getting neglected. I'm sure you've seen on the TV, I normally see it on NBS, where they say the malaria death rate is set to double this year. And then they're saying 16 people are dying, or they die of malaria every day. But this year, because of the COVID-19, the number is bound to increase. You are seeing people failing to reach healthy centers. You're seeing drugs getting out of stock. However much as pharmacists are coming in and doing drug substitution, etc., but there is a big shortage of drugs and medical supply. Yes, COVID-19 has exposed a certain level of weakness in the health sector.
Thank you.
I submit.
Yes, thank you very much. You actually raised a very pertinent issue. I saw also in part of the webinar series that we're organizing, we're going to have a panel discussion on the impact of COVID-19 on the medicine supply chain in this country. I know WHO, I think today they are making a call for the fact that a lot of the HIV patients are not able to access the medicines because of the lockdown and a lot of the changes that has been happening. So we realize and we are aware that other areas of the health sector is so much affected. So there are a number of questions on how to discard face mask. So the question is from Yona: for how long should a face mask be on before it's discarded?
Wow, that's a good one. Right now, they are saying you're supposed to have a face mask daily. But if you can change, because I think we normally use, for example, when we go into surgical centers, we normally use a face mask per patient. But right now, we are using a face mask per day.
Thank you.
But, when another day comes, we do not use the face mask of the day before.
And then the other question is, how do we discard what do you recommend as a way of discarding the face mask after they have been used?
Now, that is a very good question. You see, in this COVID-19, emphasis has been given into using face masks, etc. But it seems like no one is talking about the medical wastes. For example, somebody brought up a question in those centers where they are treating COVID-19 patients. When those used items are discarded, has government given attention to how they are treated or discarded up to the final destination? It's quite hard. But for me, what I'm doing, I'm banning.
Okay, thank you. So there are also a number of questions on the cloth mask. Gloria is asking, do the cloth masks, she's saying that from the slides that you have shared, cloth masks, they have zero protection from the virus. So how does the cloth mask help then? So there's an issue. I know that a lot of the advice has changed so much on the use of face masks. Previously, it was being encouraged only for the people who are caring for COVID patients or for the healthcare workers. But now we are moving towards having, face masks or cloth masks being used by the general public. So Gloria is asking, is it really effective in preventing COVID-19?
Okay, before I answer the question, I have to remind us that the president and his COVID team have not only guided, but have directed that every person who is going to the public should be having at least a cloth mask on their nose. And the Minister of Health came out to explain how this cloth mask is supposed to be. And she said the cloth mask is supposed to be at least double layered, okay? There is a cloth outside and a cloth inside. The logic about the cloth mask is that when you cough, the spillings do not go far away from you, yeah? And then when somebody in your environment maybe accidentally coughs, this mask is supposed to at least prevent a percentage from reaching you. I'm sure it has a percentage of prevention.
Thank you.
I submit.
Yes, thank you. So I know that a lot of the research has been looking towards the mass use of face masks in Hong Kong. So the thinking is that due to the fact that so many people in Hong Kong were using the face mask, they are thinking that somehow it has sort of reduce the transmission or the spread of COVID-19. But I know it's something that WHO is looking towards guidance from countries that are doing that implementation to see actually if they're effective in preventing COVID. I know a lot of things about COVID. We're just learning as we go along. So there's an anonymous someone, the name is asking what public health awareness campaign are currently planned in Ugandan community pharmacies. So from your own experience, Dr. Gonja, Are you conducting any public awareness in your pharmacies, in your pharmacy?
Yeah, I'm sure most of the pharmacies are getting involved. Just putting somebody at the door entrance and then instructing everyone is supposed to wash hands before they enter. You're already sending a certain level of signal. You're sending information. I remember the time when COVID had just come and I put up a water facility. I opened a tap on one end, then I put up a can and water on the other end and soap. Whenever a client would be told to wash hands, do you know what they would do? They would wash their hands, they would wash their face and head. So I served a couple of clients, and then finally I noticed whoever comes in seems to be like sweating. I asked some of the staff, what's happening? Every client that comes in is sweating. Is it too much riding of bicycles? Etc. And my staff told me, you don't know what is happening. These people, when they get chance, when you tell them to wash hands, they wash their face, they wash their head, they wash their hands to make sure when they enter, they have concrete proof they have washed as you want. I'm sure by clients responding that way, we've already given a signal. We've put up posters talking about COVID-19. Ministry of Health distributed posters, and my place has posters in and out. And when they come in, we tell them to keep sanitizing, and we are talking about COVID-19. So by doing that, we are giving in public health awareness. I submit.
Thank you. Joshua, he was our presenter last week, but he has a question here. He's saying what advice, how can you advise on how to best triage and referral patients in community pharmacies? So let's say you get a suspected case, he's asking how do you do the triage and what procedures can you use to refer that patient?
Every facility has a way it does their things. But for me, in my facility, more especially where I commonly sit, I have a referral notebook. Yeah. When I get a client and maybe I'm giving them a first aid, I'll write down their names, I'll write down their age, their phone number. I write what I have thought, my differential diagnosis. I write what I have given. I sign, I put a stamp and refer to a particular doctor. There are some doctors that I know that handle various illnesses. I call them up and tell them I'm sending someone, you have to help them. Or I send them to Mulago Hospital. This was commonly during, I'll give an example, during the time when they did mass vaccination, if you're to remember. There are times I would get clients with bizarre reactions, like the particular patient that I shared that had Stephen Johnson and the mother hadn't noticed. I didn't allow the mother to go back home. I told her, call someone from home to bring you all utensils. You are going to acute care in Mulago Hospital. I wrote a referral note. We gave what we could give to the patient, and then we referred the patient. I saw the mother get out and sit on a boda and going straight to Mulago Hospital. So that's how I do it. So every pharmacy is supposed to come up with their own framework because we stay in different communities, okay? And then we handle different types of clients. So you're supposed to come up with a framework that is suitable for your community and your clients. I submit.
So just to add on a bit, so Joshua is asking the context of COVID-19. So imagine you get a patient that maybe has high temperatures and you really suspect, let's say the patient has travel history or exposure to a COVID-19 patient. So specifically about a suspected COVID-19 case, what specifics would you add on, the referral system or the triaging that should be done if you have a suspected case of COVID-19?
You see, the government shared the numbers.
Yeah.
Yeah. And then it also went ahead to share numbers by district level. They shared numbers of nearby community health centers. For us in Kasangati, they shared a number of Dr. Katabazi. And coincidentally, Dr. Katabazi was in the same cohort with me at medical school. So when I get anything I do not understand, I call him up personally and tell him, you come and follow up this person, we do not understand. I give them details and then I see them follow up.
Okay.
So that is my strategy. But like I've said, every facility should come up with their strategy. We should not get anything that is scaring and then we go quiet. Or if not, contact the Pharmaceutical Society of Uganda. I'm sure the PSU should have a mechanism of responding to come to the rescue of the people they lead.
Okay, thank you. The other question is on irrational use of antibiotics. David is asking, what advice, do you give to community pharmacies? How do they handle, how are you managing irrational use of antibiotics by prescribers and dispensers in your pharmacy? How do you deal with it at Extra Care Pharmacy?
You see, that is another big topic that is very, very critical and hard to handle. You see, right from hospitals where we studied, they used not to do culture and sensitivity for every client or for every patient. It's hard. But for my pharmacy, what I do, I just do intensive training. Train these people about antibiotics, train them about susceptibility of bacterial infections, so that when somebody gets a cough client, they should not rush to give away cefixime to this patient. So when you do intensive training and making decision making by your staff very easy, I think it can help.
Thank you.
I submit.
Thank you. So another question from Joshua is saying, how will community pharmacies ensure rational use of both herbal and conventional COVID-related medicines upon patient visit? You understand?
That is also another hard question. You see, we do not understand very well COVID-19. And however much they're saying there is a cure, we've not seen it. Even the drugs they're talking about prevention, etc., we do not know them. Right now, I would advise let's not treat COVID-19 from our pharmacies. Let's refer to the task force. Let's refer them, call those numbers and refer the clients. I'll give you an example. In one of the issues that I was reading from World Health Organization, a certain doctor who was having his facility went ahead to put on personal protective equipment and went ahead starting to treat COVID-19 patients. And after like 1 month, the doctor who was treating also died of COVID-19. As per now, I don't think we should go ahead and start treating COVID-19 patients. Let's refer them.
Okay, thank you. So Daniel Chance, the question Daniel Chance. So we're going to have a webinar on Friday and it's going to be presented by one of the pharmacists at Entebbe Hospital. And I think he's the best person that is going to answer this because he's at the front line of fighting the pandemic. So that question, what is the percentage of asymptomatic patients in Uganda? And what is the most common symptom in Ugandan COVID-19 patients? That will be for Dr. Ismail on Friday. And then he asked how often someone should disinfect surfaces. I think you answered that. You said every 1 hour. Martha is asking, can you comment on, she's saying she has come across a concentrated jig in the market. Can you comment on the use of concentrated jig?
Yes, I can comment about the use of concentrated jig. I want to say jig is one of the items that do intensive disinfection. And when you read the World Health Organization guideline, they give you how to dilute jig to achieve a particular purpose. But for the sake of viruses, and I think also COVID-19, they said you can dilute 9 liters of water, you add a full liter of jig. When you do such a dilution of 1 to 9, you are able to get a concentration that can kill jig. But the World Health Organization website has information to do with dilution factors for jig, and achieving what percentage to kill what kind of organisms. You can go up ahead and read around it. You will get more answers than what I have given you. I submit.
Thank you. So I know on Friday when we have a presentation from Dr. Ismail from Entebbe, I know they have been doing a bit of reconstituting and dilution of Jake. I believe you will share some experience. Then Mark is also asking, she came across a patient with a temperature of 32 degrees centigrade. So she's asking, what do you tell that patient?
If I come up with a patient of 38,
32 degrees.
That is very low temperature. Number one, you first cross-check your thermometer. That infrared thermometer is tailored to measure temperatures for surfaces and temperatures for body. So you first cross-confirm with your thermometer. Is it measuring body temperature? If it's measuring body temperature, I think that patient needs to be referred. I submit.
Thank you. A number of questions came also around temperature monitoring. Someone asked on the calibration. I know these temperatures the thermometers that we use in our pharmacies, not just for measuring the temperature of patients, even the one we use for monitoring conditions in our stores, they have to be calibrated. And UNBS does calibration. So you need to have the thermometers that you're using to be calibrated. So please check with UNBS on, they can help you do the calibration. Kennedy is asking, my namesake is asking, as a doctor and a business lady, what advice do you give to government in regards to border controls and truck drivers?
What advice would I give to government?
Yes, in regard to border controls and truck drivers.
Already the measures they're putting up, I think will have a long prevention. The strategies that are coming up, this water transport is going to reduce the number of people involved. I think it's a good one to pursue. The train strategy, I think, will also reduce the number of people involved, and it will increase the luggage that comes in. And yesterday, when I was listening to this president, to the president's speech, he was saying, the interview, he was saying they are going to put up escorts to escort these drivers. I'm sure the driver thing is very challenging. The mere fact that these people seem to have homes at every stop, it is very challenging. They need to either be escorted up to the destination. They shouldn't be given any leeway.
Thank you.
And also the testing from the point of the beginning of their journey before they enter Uganda. If we can get results before people are endorsed to drive into Uganda, I think it will be a good way out.
Thank you. So Amos Uyuru is asking, how has the COVID-19 affected the availability of medicines in community and hospital pharmacies? And how would you predict the availability of such medicines during the post-COVID era? So in your pharmacies, how has COVID affected the availability of other medicines, let's say different from the COVID-19 related commodities?
This is a good question and practical. Yes, medicines have been heavily affected in our pharmacies. You will find that some of the antihypertensive drugs, some brands have gone missing. So what you do as a pharmacist, if somebody has been taking that very drug of a particular brand and then it has gone off market, it's not being seen anywhere, you're supposed to sit down your client and advise them to change to a different brand. So with us, what we are doing drug substitution. You see, we have people who are not even buying their drugs from us. They were driving all the way to Frieka, and then they get locked up and they bring a very rare drug, a very rare brand you've never seen. The only intervention we do is we sit them down and we tell them we are going to change you to this brand. And we even go ahead and ask for their doctors' phone numbers. We call doctors, we discuss, and we agree with the doctor. That's what we are doing. And then people who totally can't get who totally can't get the drug they have been using. What we do, we talk to the doctor and we change regimen. We change them to a different drug. Because what we are doing right now is saving lives, okay? When we sit with a client, they refuse to agree. I give them my phone number. I take their phone number and tell them, try. When you fail, you come back to me, we talk again. So when they fail, you see, in most cases, after like one day, they call you back. Now, Musao, I have failed. What should we do? We just substitute. It's now about saving lives. We are no longer looking at this doctor has to first prescribe, this doctor has to change regimen. We have to make sure we handle lives temporarily until when they can access their doctors after the COVID pandemic is done. That's what we are doing. I submit.
Thank you. So we are going to have, as I mentioned, one of the webinar series is going to be on the impact of COVID-19 on the supply chain, and we'll dwell a bit deep into that. We are out of time, but just a couple more questions before we go. Ismail is asking, is it protective enough for one to put on a face shield without putting on a mask?
Wow, that is another question. I don't want to commit myself, but I think it can protect you from direct spills.
Okay.
You see, it can be a good alternative for those people who can't put on face masks. I've got clients, and I will share a story of this particular big, fat client. When he put on this surgical mask, the guy almost collapsed in front of us. He couldn't breathe. And then he said, now when I die, they will have died of pressure, and yet I've died of a face mask. So for those people who have big issues with breathing through the mask, I think the face shield can come in as a good way of protecting them from danger or possible infection. That is my submission.
Thank you. There's a very interesting question from Olivia. She's asking, are community pharmacy in Uganda capable of handling point of care testing COVID-19 patients on behalf of MOH? I know, just to add a bit, I know the governor of New York put out an order that is sort of encouraging, having community pharmacies also conduct COVID-19 tests. So she's asking, are we capable in Uganda of doing point of care testing for COVID-19 on behalf of the Ministry of Health?
We can be capable if we are trained. You see, this testing of COVID-19 is being done by virologists. And the PCR they're doing is another technical way of testing for COVID-19. If they come up with rapid diagnostic tests like the one of HIV, you've seen the HIV strip. I've seen a country, I forget the name of that country. It came up with their strips for testing for COVID-19. If they made processes such easy and then they trained the pharmacies, we could be able to test a big number, but only after training. I submit.
Thank you. Number of more questions. So again, a question from Martha on the temperature monitoring. She's saying if someone, she says she heard that people are saying if someone has 37.5 degrees centigrade, they should be isolated. So she's asking basically if you measure the temperature of a patient in your pharmacy and you find 37.5, can you isolate that patient?
That's exactly what we are doing. If your temperature is above 37.2, you do not enter the pharmacy. We sit you aside. Yeah, we sit you on the veranda. We put boxes. I'm bringing practical examples. I will not tell you we put a chair there. No, we put them down. We tell them why we are putting them there, and we forward information to the COVID-19 team. And for me, I am forwarding to Dr. Katabaz.
Thank you. So I think we should be summarizing. So just Dixon is asking, do you have enough supply of masks? If everyone in the country has to wear a mask, do you have enough?
I think that's why the government came up and said that the public should use cloth masks. Yeah. And these cloth masks can be tailored by anyone who can tailor. I've seen pharmacies which stock, they disinfect, and then they put them on sale in pharmacies. Even that is possible. Now, if it were just surgical masks, the demand would be so high and the medical people would go without surgical masks. But now they said public people should put on cloth masks. And what I want to be happy about, if it's very true NITIL is producing and it's producing a good quantity, if the NITIL masks become available on market, they will be a very good substitute to these cloth masks. Why? Because I've personally seen a NITIL face mask. They have 2 layers of cloths and they have a filter inside. So that makes it 3 layers. That filter just just makes it a better and far better alternative to the normal cloth masks that are being available. So in the future, the NITIL will solve a lot of problems. So to go back to the questions, if we are to say both staff and the public people putting on surgical masks, the masks would just disappear on market. I submit.
Thank you. I'll try to respond to some of them for the sake of time. There's a question on cold and flu. So in the webinar last week, Dr. Joshua had a very nice table on how to differentiate, cold and common flu, then maybe suspected COVID-19 patients. So it would be nice to look at that presentation. It's on our YouTube page, and also we shared the presentation from that. So the other question is, comment on the alleged Madagascar herbal claiming to cure COVID-19. Do you have any comment on the herbal products for Madagascar for curing COVID-19?
My comment about the COVID-19 treatment, Ochua by Madagascar, I think it's a very, very good development. And the mere fact that they're giving it to their clients, to their people, and they are showing evidence that they're getting healed. And if they're giving it to their people and they're showing very low levels of cases, I think it's a good thing that should be developed. I was happy when African Union came on board to help them do clinical trials, do the research, do continued research on the COVID-19 disease. I'm so happy about the COVID-19 treatment. And if positive results keep coming out, let them share it to the whole of Africa so that we get out of this mess. I submit.
Thank you. Just this one is, can you comment on the fact that some pharmacy owners are downsizing, because they are not making enough money, downsizing the number of their staff?
Can I comment about the people who are downsizing?
Yes, pharmacy owners who are downsizing their staff.
You see now, if you've read the document that came out from the Ministry of Labor and Gender, I want to tell you this is an issue that the government also is failing to handle. And it's an issue that the government is failing to commit itself to. It's just like the landlord and the tenants issue. The government is totally not committing itself to those 2 things. Actually, 3 things: the workers, the tenants, and then the thing of banks and interest rates on loans. The government is totally not giving its position or committing itself to those 3 things. About workers, yeah, I think it depends on the company. Me personally, I did not lay off anyone. I left everyone work. What I did, I just put up shifts. Okay, they are still getting their allowances. They're still getting their salary. I know it's very tough, but for me as a company, that's what I do. I make sure everyone is comfortable. For other companies, when they become so constrained, they may go ahead and give a half salary, which I actually encourage. If you had many people, make somebody work 2 weeks and then make the other team work 2 weeks and pay them a halfway. They will understand, instead of them going and they totally have nothing to eat. If you're heavily constrained and then the people were so many, let them work at least 1 week and pay them for 1 week, 1 week, so that they have something to eat in their homes. So that would be my suggestion.
Thank,
About work and stuff, I submit.
thank you. Just two last questions. We're out of time. There's a follow-up question from Martha, the medical waste. She's asking, what kind of burning are you practicing? The masks that have been discarded, how exactly are you doing the burning? That's a question from Martha.
Pardon?
How are you doing the burning for the masks that have been discarded? The waste, the mask waste, how are you doing the burning?
I don't want to give a lot of information to do with this, because I may end up letting out information that conflicts with the guidelines of municipal councils and towns, etc. But what I know is that if you put these face masks in the bin, there is high probability the person who will take this waste for disposal will also get into contact with the infections. So for that, I don't want to give a lot of information regarding it.
Thank you.
I submit.
Thank you. One last question. This is from someone who is anonymous. What advice would you give to, what would pharmacists advise on the issue of highly raised price of some medicines and medical supplies in some pharmacies, sanitizers and masks? The issue of prices going up for medicines in pharmacy. What advice would you?
Advice would be to look for alternative suppliers. At times, you may be glued to one supplier, and yet with them, they are being very expensive. I'll give an example for hand sanitizer. You would find Suraya hand sanitizer being sold at 130 in one of the pharmacies at William Street. You go to Friaka, the same thing is being sold at 50,000. And yet Friaka seems to be like a community pharmacy. So when you do comparisons, you can buy from Friaka. For still hand sanitizers, if the others are being hard, you go to pharmaceutical society and buy a cheap one. So the answer in the discrepancies in prices, you first do your survey before you finally decide to buy on a particular distributor.
Thank you. That's the last question. Thank you very much.
That's
Dr.
my submission.
Thank you very much, Dr. And just a reminder before people leave, we have a feedback form. So as you're leaving, you'll be prompted to fill that feedback form. Please, I kindly request to fill a feedback form. That's how you're going to help us improve this webinar series. So as I mentioned, this is a series. So our next webinar is going to be on Friday. We are going to hear from a pharmacist that is on the front line fighting COVID-19. So we, as Pharmaceutical Society of Uganda, we recognize the good work that you're doing, and we appreciate you, and it's our duty to help you to stay safe. So if any help, any guidance, you have any questions, please don't hesitate to reach out to us. editorial@php.or.ug or via social media. We'll be able to respond and guide you accordingly. So thank you very much. We'll see you on Friday for our next webinar. Stay safe.
Thank you, Kent, and bye-bye.
Thank you.